let's talk about the course of ureters. Well, the course of ureters, in picture A, you can see it here. It arises from the renal pelvis, travels under, very important, travels under gonadal arteries, over common iliac, and under uterine artery or vas deferens in the retroperitoneum. So you have two unders and one over. So gynecological procedures, for example, ligation of uterine or ovarian vessel may damage ureter, leads to ureteral obstruction. So if you have any gynecological procedure and incompetent gynecologist, they might ligate, abnormal ligation of this uterine vessels, and uterine vessel has a close proximity with the ureters. So while ligating that, they also ligated the ureter. Now, when you damage the ureter, it leads to, so when you damage it, it's going to either leak or cause obstruction, and you suture it up, it might cause obstruction, right? So either you're going to leak or causing obstruction. So bladder contraction compresses the intramural ureter, preventing the uterine reflux. So now, very importantly, they're saying if you have this bladder and ureters open into the bladder, how come the flux is not refluxed back into those ureters when there is so much increase in pressure? So the answer is because you have so thick muscle of that bladder, right? So when it contracts, the intraluminal, so this was the luminal, right, ureter, it contracts this intraluminal ureter, preventing the urine reflux. Now, blood supply to the ureters are proximal renal arteries, middle of the gonadal or aorta, and common and internal iliac arteries, distally of the internal iliac and superior vesical arteries. And then the three common points of ureteral obstruction are where it can get obstructed is either in the uretero-pelvic junction, UPJs, pelvic inlet while it is coming into the pelvis. Let's say this is the pelvis and it's the inlet, or in the uretero-vesical junction. Looking at the picture on the right side, let's look. So water, that's a mnemonic here. Water flows over the iliacus and under the bridge, uterine artery or the vas deferens. Okay. So looking at a picture here, ureter is coming down. You have the vas deferens in males, which is above it. And then you have the uteral orifice within the trigone of this bladder. Okay. And you have uterine artery in the females as compared with the vas deferens in males. So a couple of points to be mentioned in this one are as follow. So which gynecological procedures are we talking about when we said might mess up the ligation, might damage the ureter? We're talking about hysterectomy or pelvic and abdominal surgeries or pelvic lymphadenectomies. And when you mess up with the ureter, you're going to have a back or flank pain with fever. For hysterectomy, ureter lies posterior to the uterine vessels to ligation. So ligation of these vessels can cause damage to the ureter, but no anuria will be seen as the contralateral ureter is able to void urinate normally. Or you can also have this in oophorectomies, in which the ovarian vessels are ligated, leads to ureter injury. Okay. So something, when we talk about these three common points of urethral obstruction, we are looking at the UPJ, right? This one, UPJ. UPJ, if you have an obstruction in the UPJ, it's going to cause flank or upper abdominal pain. Okay. So UPJ is causing this upper abdominal pain versus uretrovesical junction. At this stage, if you have an obstruction, then you are going to have a lower abdominal or even groin pain. So that's how you can differentiate between two: lower abdominal or the groin pain. And now the pelvic inlet is only left. So pelvic inlet is the intersection of ureter and iliac artery. What is the inlet? You have this intersection in which the ureter is coming in. There's intersection between them when the ureter and the iliac arteries within the pelvis. Okay. So in the blood supply now, you have the renal artery at the proximal middle. You have this gonadal aorta, common and internal iliac arteries. And in distal, this is the most prone to damage. Distal area, it is the most prone to get ischemic injury, prone to get ischemia in transplant. So in kidneys transplant, the failed kidney is left in place, and the donor's kidney is and the donor kidney is placed retroperitoneally in the right iliac fossa by anastomosing the donor's kidney renal artery to the patient's external iliac artery. The proximal part of the donor's ureter will be the proximal part of the donor's ureter will be fine. So now the question is the proximal part. So when you are doing the kidney transplantation, the proximal part will be fine of that donor's kidney, because it gets blood from donor's renal artery. But distal portion will be prone to ischemia due to lack of anastomosing connection, leads to leakage, leads to ischemia infarction. So when there is an ischemia, it leads to leakage of urine 5 to 10 days after transplant, which leads to pelvic fluid leakage into the pelvis. So maybe to explain that is just the fact that when we transplant, The proximal of that transplant is fine, but the distal is more prone to get damaged or to ischemic injury because it's not supplied by the renal artery, but supplied by the internal iliac. Due to lack of, and when you are connecting the kidney, when you connect the kidney, you do connect to the renal artery, but you're not connecting all the ureter to its different arteries. For example, you're not connecting ureter back to the internal iliac, so this distal portion of the ureter is prone to get ischemia. And then once you do develop a ureter ischemia, then you have the leakage of urine 5 to 10 days after transplant. Okay? So that's what we have. What else? So just as far as definition goes, we know that it arises from the renal pelvis, travels under gonadal arteries. What are the gonadal arteries? We have the ovarian, testicular. They're all the ovarian gonadal arteries. Anterior to, and this is going to become anterior to internal iliac artery. Which leads to under the uterine artery in females, and under the uterine artery, which is in females, or the vas deferens, which is in males. Okay. So yeah, that's all we have, and just to add some anatomical picture here, just remember this is what we were talking about here. So this is the common common iliac artery, and this gives off internal iliac artery, and that is just going under this. So this is the ureter. Okay, so that's all we have for the course of the ureter.